Hi, I'm Mark Cooper, board-certified gastroenterologist, and we're talking about procedures I perform to investigate the health of your gut. An esophagogastroduodenoscopy is a mouthful, so it's commonly abbreviated an EGD. And it is a mouthful because it involves putting a scope over a meter long down your throat. And so let's talk about what that actually entails and why would you want to have such a thing done. First off, be assured, when performed by a skilled endoscopist, an EGD is very safe. And the upper endoscopy is a very flexible instrument. So while it's long, it's quite thin, and you're going to be comfortable because anesthesia is there to help you out. And in the endosuite, there is a large team, but be assured, they're all on your team. We're going to talk about that in more detail. You would be asked to do an EGD because of various symptoms. There's no strict indication to have an EGD like there is a colonoscopy. But let's say if you're having trouble swallowing, or you're having discomfort in your stomach, or if there was concern that you might have a condition like celiac disease, these would be reasons that you would have an EGD. One thing that'll definitely get you on board about an EGD is that there is no prep. Okay, you don't have to go through the same prep as you do a colonoscopy. Rather, we simply ask you not to eat. The stomach will typically clear itself out over about 4 hours. For good measure, we allow 8. So the night before your endoscopy, you'll have your last meal before midnight, and then the morning of your procedure, you're going to be going to one of two sites. You'll either be going to an endoscopy center, and this is the perfect place to get an EGD if you're young, you don't have any concerning comorbidities, and that this is a relatively routine procedure. Now, if you were older, you have certain comorbidities, or if I need to do a specialized procedure that's higher risk, then that's something that I perform at a hospital where we have the safety net that can help you should there be a problem. When you come into the endosuite, like I say, you're going to meet a big team, but they're your entourage. They're there to help you. You have myself, the GI doctor, accompanied by the endoscopy tech who helps me with getting certain instruments, taking biopsies, and getting them processed ready for pathology. The endo nurse is there as your advocate to ensure we have a safe procedure and that we follow all the rules. We also have the anesthesia team, and they're there as your bartender to provide you anesthesia to make sure that you're asleep and comfortable throughout the procedure. Now, the anesthesiologist is overseeing your case. You'll meet them. The CRNA, or an anesthesiology assistant, an AA, may also be part of your case. They're there together working to ensure your safety throughout the procedure. One more thing before we get started, we'll do a safety check, and then we're going to ask to place a bite block. This is put into your mouth. It can be a little bit uncomfortable, seems a little awkward. It's there to protect your teeth, to ensure that if you had any loose teeth or dental work, that we don't knock that around. So then you're put to sleep and we're ready to get started. So what do we actually do? We're going to be taking the endoscope and putting it down your mouth. I don't really look much at your mouth itself. My interest begins at your esophagus, the first organ that's the responsibility of a GI doctor. We then continue down past the junction between the esophagus and the stomach into the stomach itself. We blow that up with air so it becomes cavernous and we can get a good look at all the major landmarks. Essentially, I'm a tourist in your stomach and I'm looking to take pictures and find any kind of concerning problems. We then continue our journey down into the first part of your small intestine, which is called the duodenum. This is an interesting part of your intestine because it's where all the juices created by your liver and your pancreas drain in through a little valve called the ampulla. And so we see this area with bile flowing in it. If there's any concerns in any of these multiple areas, we can take biopsies. If there was a polyp, we would remove it. If there's bleeding, we aim to stop that. As the procedure concludes, we draw out and you're awakened. So as you wake up, you're going to wonder, how long did that even take? It seems like it was no time at all. And it really is not a very long procedure. It's typically 5 to 10 minutes is sufficient to give us a good look. If we have to do more intricate work that could move towards 30 minutes, there's times that in a critical situation, I may be doing a very fast endoscopy to rule out major bleeds. If I find one, then we may actually be there even upwards of an hour trying to control that event. Point is, most people, it's a relatively short procedure. However, from your family's perspective, it's going to seem to take a little longer. And that's because you have to go down to the endosuite, there's some recovery time, and so they typically see this as if it's taking about an hour. But from your perspective, it's going to be over before you know it. And it's not uncommon that when people wake up, they say, have we started yet? As I said earlier, an EGD is generally a very safe procedure when performed by an experienced endoscopist, but there are rare risks. A person could have bleeding, a tear or perforation that may require emergency surgery, or an infection. Generally, we're concerned that may come from the equipment. Bleeding is very uncommon. It's more typical that we're actually performing an EGD to stop bleed that arrived in an emergency room. An infection is quite a low risk, thankfully, because we go through several sterilization procedures every time the endoscope is used. Finally, a perforation is an exceedingly uncommon event, especially during routine endoscopy. So you can be assured that an EGD is a safe procedure, as is typically anesthesia. People more commonly will have concerns about their throat, because the fact is we're taking a fairly sizable instrument going down your throat, and so it's not uncommon that afterwards people have some discomfort, symptoms that may be somewhat similar to an upper respiratory infection. I'd say this occurs maybe about in 5% of people, and it usually resolves even hours after the procedure, or at most a day or two. People worry about pain of a biopsy. The forceps are really small and the tissue that's removed is also quite tiny. Deep in your stomach, you have really no sensation of this. But as we move up higher in the esophagus, some people may feel the biopsy bites, and that can be kind of a stinging type sensation. That also may last for about a day or two and usually resolves after. And it can actually be a diagnostic clue. This tends to happen more in people that may have an infection or in someone that has a hypersensitive esophagus. So we can actually find that to be informative for what's going on. Now, after all is said and done, any biopsies that are taken, they need to be read by a pathologist and then returned to the gastroenterologist, a process that takes some time. We'll generally know immediately after the procedure if we're deeply concerned, and we'll let you know that. Any biopsies otherwise can take some time, about a week, in order for the office to get back to you with the final results if your GI doctor had any other concern. People also want to, of course, know, is it time to eat? And almost always you can go ahead and eat, except for in special circumstances when we perform certain procedures. But for any routine endoscopy, you can generally eat immediately afterwards. Many people that have it in EGD may be on a blood thinner, and it's important to know when you can resume that, because we'll often have advised that you hold it because some of the procedure may increase the risk for bleeding. And that's a case-by-case basis, and so you should leave the endoscopy center with knowledge of when you'll be resuming your anticoagulant. Overall, I hope you found this information helpful. I hope it gives you some assurance about getting an EGD. It's general information, though, and it's not intended to be diagnostic or medical advice. So if you have questions, please ask your provider. Thank you for your time. I'm Dr. Mark Cooper. If you find this informative, please subscribe. Let us know questions in the comments below. Be safe.